Hello, Connecticut, and welcome to the Paid Leave Podcast. The title basically says it all. I'm Nancy Barrow, and I will be delving into this new state program and how it can help you and your family. This podcast will give you information you should know about Connecticut paid leave and maybe just a little bit more. Connecticut paid leave brings peace of mind to your home, family, and workplace. Welcome to the Paid Leave Podcast. May is Mental Health Awareness Month. It's also Maternal Mental Health Month and National Adolescents Health Month and Children's Mental Health Awareness Week from May 5th through the 11th. May is a busy month. Connecticut Paid Leave gives up to 12 weeks of income replacement for your own serious health conditions or that of a loved one. That includes maternity and bonding leave and mental health issues if your healthcare professional deems it a serious health condition. My guest today is State Representative Kai Belton. She was elected in a 2023 special election to the Connecticut General Assembly for the 100th district that includes Middletown. With almost 2 decades of service as a licensed master social worker in Middletown, Representative Belton is known for her dynamic leadership and strong advocacy, particularly in victim services and children's mental health. And she serves on 3 crucial committees: Appropriations Committee, the Committee on Children, and the Vice Chair of the Public Health Committee. Her passion lies in creating a better Connecticut by advocating for quality health care for all and equity and justice. Representative Belton works for the well-being of all Connecticut residents, and outside of the legislature, she's currently employed by the Connecticut Coalition Against Domestic Violence, known as CCADV, and is the vice president of programs there. And she is also a mobile crisis clinician at Middlesex Health. Welcome to the Paid Leave Podcast, Representative Belton.
Thank you, Nancy. I am so happy to be here.
Tell me about your journey into politics, if you can give me that. And is everything is it everything that you expected it to be?
Well, I have to say I was talking with Representative Q Williams, who, was like, well, you should join the Democratic Town Committee. So I was like, okay, I'll, check that out, see what it's about. So I joined, and I ended up taking this class, this training program, Emerge Connecticut, that trains Democratic women to campaign and run for office. And during that time, what I was thinking is one day I might, run for Board of Ed or, something like that. I never thought about being a state representative, senator, nothing on the state level. It's just not my one thing that I always think about is that, there's a lot of, public interaction, right? And I'm like, that is just not who I am. And Q was that person, right? So it was like perfect for him. Just wanted to be more informed and a little more active. And then, then we had the tragic death of Representative Williams, and that is really when things changed. Shortly after he passed, I was asked to run for his seat, and I was like kind of upset about that because I'm like, why are we talking about running for his seat? Like, he just passed away. But, the Republicans in our town had already had somebody ready, and we were like, we have to do something. And I still said no. I said no like 2 or 3 times. And then, I started to think about Q and how he was always championing women's voices and, how we should be more involved and more active in government. And I was like, okay, well, I'm going to just try it, right? I'm going to put my name in the hat. If it doesn't work, it doesn't work. Really didn't want to do it anyway, but at least I can say I tried, right? And I had no idea that this was going to happen, and put my name in the hat, did the candidate interview, and I was the chosen candidate. And I was like, what in the world? So
must have been meant to be, though. You have to kind of think of things in that nature.
Absolutely. And, I find it funny that people would say to me, well, Q would, speak about you, in rooms, and, he would say, things about like how you would be great at this or that. And I'm like, well, he never told me that. He never, like, he lifted me up, but he never talked about, well, if I wasn't in this seat, like you would be one of the people that, I would want, to run. And, just hearing that really gave me some courage and confidence to do it. And so I'm here.
And how does it feel to be Middletown's first Black female state representative?
I am the first, but I am not the last. I look at it like Q opened that door for me as the first Black man, and I am the first Black woman, but I am not the last. I'm leaving that door open for many, many more. And it's an honor, and it comes along with a lot of pressure, obviously, because you don't want to screw that up, right? Because everyone is looking at you to, because they have their own expectations of, what Black people should be doing and, and how they behave and, all of the things. So, there are plenty eyes, on me, just like there were plenty eyes on Q. So it's a lot of pressure, but, I'm up for the job. I'm up for the task.
And how does it feel being a role model now for younger Black girls who look at you and say, hey, if Representative Belton can do this, I can do this?
Yeah, I think about that all the time. I'm like, and I have a daughter too who is a social worker who never thought about politics before, and now she's like, Mom, like this is so amazing. Like, I see her exploring things now that I didn't before, but also, the young people in my community, they say that, and I used to work in the school system. So, when I see young people, I used to do this Girl Talk summer program. And when I see some of those students, the interest now that they have in politics because I'm here, it just makes me so happy. They want to know more because it doesn't always look like a space for us, right? It doesn't
Right.
always look like a space for women. It doesn't always look like a space for Black women. And I think just having me here really gives people the opportunity to explore, the possibilities. And this summer, I'm actually doing a Miss President US summer program for young women who are in middle school. And it's really teaching them about government, it's teaching them how to run for a campaign, how to do a campaign, and they actually have an election. So
That's
it's
great.
really great, and this is going to be the first time it's ever been done in Middletown, and I'm really excited about it. I really feel like this is another way to to lift the voices of young women and get them exposed early.
And that's so important. I'm going to shift gears a little bit and ask you to tell me a little bit about being the chair of the Black Maternal and Infant Health Caucus. How did this come about?
Okay, so I was very new to the legislature, and at that time we had 6 Black women in the entire legislature. Now we have 4, and there, was a lot of talk about the maternal health crisis, and I really felt strongly about the fact that we needed to be at the center of these conversations because this is something that we live every single day. All of us had stories, right? So, and we have family members who have stories. So I went to all the Black members, all the Black women members, and I told them what I wanted to do, that I wanted to form this Black Maternal and Infant Health Caucus. And Robin Porter was very supportive. It was something that she had been thinking about doing. So she helped me, we came up with the name, the mission, and I went to all the Black women legislators, and I was, telling them, what what I wanted to do and asking them, if they would sign on to this letter with me to form the caucus. And they all agreed. So then we put the call out there to other legislators, and we have a bipartisan group. We have over 30 something members. And what we really do is focus on changing outcomes for Black mothers and babies. And we do that in many different ways. But we have a very supportive group. Everyone is very engaged, and we are really the center of the conversations that are happening, the center of the policy.
Well, I know Black maternal deaths in our country are 3 times higher than white women. Pregnancy complications 2 times as likely in Black women. Let's talk about the issue of racism in healthcare. You work as a mobile crisis clinician at Middlesex Health. What have you seen, and what are your thoughts about combating it? Is it with this caucus?
So,
it's a big question. I'm sorry, but it's a huge question.
So, I think good policy can come out of this caucus, but this is a historical issue, right? Like, this is racism that has been happening for so many years. I mean, Black people historically, we're used as specimens and not humans. So that trauma lives in our DNA, right? Mm. So when it comes to the healthcare system, it's not our favorite place.
Yeah.
So it's really, really important for us to have healthcare workers who look like us.
Yeah.
Because that's where the trust comes in, right? And you think about preventive care and things like that. If we had more people in the workforce that looked like us, we would live longer. We would live, And when it comes to maternal health, I think that having someone by your side who understands your experiences culturally, and can advocate for you and empower you is extremely important. And, I value doulas so much because I think they are invaluable to mothers and birthing people during their birthing journeys. My daughter is actually studying to be a doula right now.
Oh my goodness, how great is that?
Yeah, it's amazing. And it's even more amazing that my daughter-in-law is having my son and my daughter-in-law, they're having their second baby. And my daughter is going to be her doula. So I'm really excited about that.
That's wonderful. And I hope that they use Connecticut paid leave and they use the bonding that they need to. What was your experience as a mom and having your child? Were you listened to by the medical community, or did you have great medical care?
Actually, my first child I had when I was very young. And I was having preterm labor. I was hospitalized for it. I was still having contractions, and they were trying to send me home. And I was telling them, I'm still contracting, like I'm still feeling a lot of pain. They told me I was fine. Maybe like 6 hours later, I came back to the hospital because I was in so much pain. And I remember the doctor, a white male doctor, saying to me, "You're back." And I was like, "Yes, I'm in a lot of pain." And I remember him saying to me, "Well, you're not in labor. You just left." Right. And at that time, I had state medical insurance. So, looking back on it, I could see so many things. I was young, I had, Medicaid and, so he didn't believe me. And, they had someone, check to see how much I was dilated. And I just hear people like yelling and rushing, and my child was coming out, and I had him in my t-shirt, and I had just turned 7 months. He was 2 pounds 9 ounces.
Wow.
So that was a very, difficult time because if I was listened to, and had my needs met, my baby could have been in there a lot longer and we could have avoided so much, so many medical issues over the years, so much stress, and a lot of like trauma, honestly, for him and for me. So it definitely impacted me. And this is another reason why, this is so real to me. And I'm so passionate about it because I feel like when you go to a hospital to get help, you should be listened to, no matter, how you look
Mm.
or your income level.
Hmm.
You should be supported and you should have quality care.
Well, we appreciate that you shouted out Connecticut paid leave during your announcement of the Black Maternal and Infant Health Caucus. We thank you for that. But can you tell me how you see Connecticut paid leave helping your constituents in Middletown, or the people that you talk to, or the people you run into?
Yeah. So when I think about um, Connecticut paid leave, I think about how important it is. It's a huge support for working families, for caregivers, and those who are managing serious health conditions. You think about, like we just said, about bonding with a new baby or caring for a sick family member. These scenarios could leave some people homeless and in these, really bad situations if they don't have the support like Connecticut paid leave provides. So, you know, working people can have that time to deal with these, serious illnesses or domestic violence or, mental health needs without the loss of income. And I think that that is extremely important. When someone is experiencing domestic violence, like they're in crisis, right? It's a traumatic time, they're in crisis. And this can look like, severe anxiety and depression. Um, and you still have to take care of your children, right? You have to make sure that they're in school or they have childcare or they're cared for in some kind of way. You might have physical injuries that you're trying to tend to. You're fleeing a situation, so it could be a shelter or
Mm.
some place that's unfamiliar to you. So you're having to adjust yourself and your family. So these are all things that take time. Time is so valuable and it is needed to start this long healing journey, right?
Yeah.
Because it's only the beginning. So those 12 days, of time and income replacement, that is a lifeline for folks. It really is.
Yeah, I think it's amazing that you're doing the work that you do in the legislature, and then you're doing this really important work, working for CCATV. How does that not burn you out?
So people ask me this all the time.
Yeah.
So first, I want to say this. I don't think a lot of people know this, but legislators make no money.
You're a really active politician. You're active on your socials and the state website. Why is that important to you?
When you said something about this earlier, I laughed a little because that took time because at first I was like, why is this important? Like, I just want to do the work, right? Like,
Yeah.
I'm not a social media person. I don't like to typically do interviews or anything like that. I'm like, I just want to do the work. But, someone said to me, and it really clicked. People elect you and they expect that you are up there doing the work. But how are they going to know? How are they going to know what you're doing? Like, you need to keep them informed. You need to keep talking to them. You need to keep telling them what's going on. They need to see you.
Mm.
And that is important to me. That is important that my constituents know that I am up here working for them. That's why I do try to be active on social media now.
I'm not trolling you, but I did go to your social media and I saw that you had a picture with U.S. Senator Cory Booker. And of course, he's so amazing anyway, but the filibuster was just ridiculous, right? Did he offer you any advice, or was it just a quick meeting for you with Cory?
He did. He's amazing. Like, he listened to my whole story about how because when I met him, I was probably a legislator for like 3 or 4 weeks.
Right.
So, we talked about Q and I told him, I'm completely out of my comfort zone here. And he was like, but you're here. And he was like, and I know you feel like those are big shoes to fill. And he was like, but don't worry about that. You'll find your own path, And I remember him asking me, so what are you passionate about? And I was like, everything. He's like, yeah, you're going to be around for a while. So I actually have that picture up in my office because, I feel like the talk we had was very inspiring, but it also just hearing his story and how he got into politics was just inspirational. And he's someone that I really, really look up to. So, I have that picture here. I have Q's picture here in my office. And, sometimes I yell at the picture. Sometimes I'm smiling at the picture and I'm saying, I hope you're proud,
What are you really proud of that you've accomplished so far, Representative Belton?
So I'm proud of myself for showing up. And
Right.
it's hard. Sometimes it really is hard when this has not been your life. Like, I have lived a quiet, behind the scenes life. And I show up for the state of Connecticut every single day. And I'm really proud. I'm really proud of that.
What would you like people to take away from this podcast during Maternal Mental Health Month?
Mental health complications and conditions are a leading cause of death for birthing individuals. And, anyone that's giving birth deserves a healthy pregnancy, a healthy birthing experience. So I just encourage people to use your voice, in your family and in your community, on the state level, just advocating for this issue. And anything else that you're passionate about, just, use your voice. But I think a lot of times people don't understand, how serious the mental health conditions can really impact people who are pregnant and who have already given birth, because we know most of the time it's after that mom or birthing person has given birth that, these things occur.
Yeah, and that's why bonding leave is so important, right? So they can take that time away and really just focus on themselves, getting better and healing, and that little baby, that new addition to their family.
Yes. Start that healing journey and bonding with that baby. I look at it like this. We have healthy mom, we have a healthy baby who grows to be a healthy young adult. And then a healthy adult, we have healthier community. We have a healthier state. And it all starts with that mom before she's even pregnant, right? So we have to look at it like that. Like, this is not just, one, incident or situation. This is like throughout the lifespan. We're creating healthier communities.
Time flies, Representative Belton. But are you thinking about running again in 2027?
Absolutely.
Oh, that's awesome. That's fantastic. We need more women like you. You are just really amazing. And I really want to thank you, State Representative Kai Belton of the 100th District in Middletown, for being on the Paid Leave podcast. I know your time is really precious, and I'm so thankful that you came in and talked to me.
Thank you for all of the work you do. And, Connecticut Paid Leave is an invaluable resource to our state. And thank you.
This has been another edition of the Paid Leave Podcast. Please like and subscribe so you'll be notified about new podcasts that become available. Connecticut Paid Leave is a public act with a personal purpose. I'm Nancy Barrow, and thanks for listening.